from the broadcast center in Los Angeles, this is KCAL-9 News at 10. Live, local, late breaking.
I thought I had a brain tumor. I thought it was over. After a battery of tests and spinal taps, all that crap, they walked in the room and said, boom.
Well, it had been rumored, and today actor Charlie Sheen confirmed his HIV status during a live morning television interview. Well, Sheen's diagnosis has prompted a new round of medical questions surrounding the virus.
And we want to take some time now to answer a few of those questions. We are joined now by Michael Weinstein of the AIDS Healthcare Foundation in Hollywood. And one of the things that struck me about Sheen was that he said he can't pass along the HIV virus because it is undetectable in his blood and his medication is preventing him from spreading it. Is that necessarily true? Because then wouldn't anyone not be able to spread the virus if they have it? Well, it's nearly true. To the extent that people are undetectable in most cases, in the overwhelming majority of cases, 96+%, they would be rendered non-infectious. The only caveat on that is, first of all, before he knew he was positive is the time when he would be the most infectious. That's one issue. And then also... You mean the beginning, when he's initially infected? Right, before he knew. Okay. Number one. And number two is that a lot of patients have a problem with adherence. So a large percentage of patients go on and off therapy. So, for example, if you're having sex with somebody who says they're undetectable, we're safe, you don't have any assurance of that, so you really shouldn't endanger your own health by taking that assurance. But to the degree that Charlie Sheen is undetectable, that would render him virtually non-infectious.
Michael, so many people go without the treatment if they're infected. Why? Is it expensive? What's the problem here?
Well, I think, first of all, that there's a sense of denial, right, that you're going to get sick. And I think people think, well, I can wait. But the reality is that every study has shown that the earlier people start on the treatment, the better they do. So we really urge them, if they know they're positive, to get into treatment. If you don't know your status, get tested. If you're sexually active, use a condom and get tested regularly. But I would say people who think they can't afford it, that's not the case. Free treatment is available. AIDS Healthcare Foundation provides it. Many other organizations provide it, as well as Los Angeles County. So anyone can get care regardless of their ability to pay through federal programs and other programs that exist. So that should not be deterrent. But I think the other big issue is stigma. I think that when people go into treatment and then they have to talk to their families or loved ones about it, when they see the medicine bottles and they have to explain it, I think that prevents a lot of people from going into treatment. I think a lot of people don't know that the drugs have come a long way. They're very, very refined. They're much different than they were in the early 90s. And in movies, the way they were portrayed, like in the early days of like Dallas Buyers Club, where they portrayed how people were basically going underground to get AZT and some of these other drugs that had very terrible side effects. That's not the case anymore. And people have been pointing out today that people can live long lives with the virus. Absolutely. And first of all, the side effects are much less than they ever were. Also, it's much more convenient. Most people are on a regimen that's one pill once a day. And we've only had these drugs about 20 years, but it would seem as if people can have a normal life expectancy. That's not to minimize the effect of this. And obviously, by virtue of the fact that Charlie Sheen, he talked about a lot of the depression that he went through, which is very characteristic of a lot of people when they're diagnosed. So there are very serious consequences across the board to relationships, etc. So certainly we want to discourage people from putting themselves at risk of getting infected. But definitely, we've come a very long way, and people can live a long and healthy life. And that's part of why we do the advertising we do. You see those billboards around town, and it says, live HIV healthy. Definitely, that's the prospect we have now. I'm sorry, so real quick though, the point is, whether you're undetectable or not, shouldn't there be a responsibility to tell people that you are HIV positive if you're going to become sexually active? We certainly feel that people should disclose, that the person has a right to know. But on the other hand, there's a push in some circles to criminalize HIV, and we think that's not a good idea from a public health point of view, because it's just going to drive people underground.
Okay, Michael Weinstein from the AIDS Healthcare Foundation from Hollywood, thank you very much for joining us this evening.
Thank you.